Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. January is National Cervical Health Awareness Month, so I caught up with obstetrician gynecologist Dr. Sarah Humphrey from the CMH Women's Center. We're talking about some simple things we can all do to prevent the spread of a virus that causes cancer in women and men. Join us. So today I am joined by Dr. Sarah Humphrey, and we are talking about women's cervical health. Welcome.
Thank you. It's great to be here.
We're glad to have you on. It's the first time on the podcast, and I know you and I have talked a lot about various issues over the years, so I'm glad to finally get you on the podcast and talk about an issue that has some pretty serious quality of life impacts for women of all ages. So why don't we start with really basic stuff? What is the cervix and why is it important to women's health?
So the cervix is also known as the neck of the uterus. So the uterus is where you menstruate from and where a baby grows when you're pregnant. And the cervix is kind of the neck of that. And the cervix is needed so that when you are pregnant or having a baby, the cervix helps keep the baby inside. And then when it's ready for it to come out, the cervix will dilate. The problem is that the cervix can also become cancerous, and cervical cancer tends to be more common in younger women. And so we really need to keep an eye on that to make sure that doesn't happen.
Why is it more common in younger women?
We think that cervical cancer is caused by a virus called HPV, or the human papilloma virus. And this virus is sexually transmitted. However, over 80% of the population has this virus, and it's not always able to be tested for in men or in women unless a pap smear comes back abnormal. And younger women are more likely to have this virus just because they have started having intercourse. Eventually, the virus will typically be cleared by the body. And so older women may have already cleared it.
Okay. So if 80% of people or 80% of women roughly have this virus, how many people are getting cervical cancer from it?
13,000 women in the US each year are diagnosed with invasive cervical cancer, but the disease is completely preventable with the HPV vaccine and with appropriate pap smear screening.
Okay, so I noticed that some things are changing in my annual Well Woman exam. Honestly, it wasn't as bad this time. And what I learned was that I got the HPV test. So what's changed and what is it telling us?
Yeah, so when the pap smear was first invented, all we really had was taking a few of the cells off the cervix and looking at them under the microscope. As you can imagine, sometimes a precancerous area could be missed, or there is a lot of inter-observer variability on the person who's reading the microscopic slide. In the last 15 years, we've been able to add HPV testing, specifically the types of HPV that are more likely to cause cervical cancer, to the pap test. The HPV testing is a lot more accurate in detecting precancerous possibilities. And so at this point, we're using the pap smear in addition to the HPV test to categorize patients into whether or not they need further follow-up. And so the HPV, we think, is more accurate in detecting that. One day, we may eventually move to HPV screening only without the pap smear, but at this point, we're still recommending both.
Okay, so it's like basically the gold standard has shifted.
Yes.
And do you still need to get it done every year or has that changed as well?
So that has changed. So in the last, I would say, 8 years, the guidelines had changed to being able to do it every 3 to 5 years, as long as you were having normal pap smears. This and negative HPV testing. If your HPV comes back positive or your pap is abnormal, then you may need more frequent testing. So this does not apply to any abnormalities.
Okay.
If you are under the age of 30 and you're having normal testing, you can have testing every 3 years. Over the age of 30, If you have a normal pap smear and negative HPV, they're saying that you can increase that screening interval to 5 years.
That's great news, but does that change, how often you need to go in for a pelvic exam and all the other well women screenings that get done?
That's a great question. And it's a little bit up for debate and personal preference. So, most doctors will recommend that you have an annual physical exam, which means kind of a head to toe look over and discussion of preventive screenings about once a year. And as a gynecologist, I think that the vulva and the vagina should be included in the head to toe physical examination. However, these types of exams can be more uncomfortable and invasive. And so a lot of women will choose to only have them at the time of pap smear screening.
Okay.
Most OBGYNs feel that having an exam every 1 to 2 years is a good idea because we do find abnormal things. But there are some other national societies that are saying there really is no need to do that unless the woman is having any abnormal symptoms. So the jury is a little bit out on that particular matter.
Well, and as in everything that's, medical science, it evolves and it changes, so in another couple of years, maybe everybody will be agreed or maybe there'll be
Exactly.
even more widely disparate ideas. So let's talk about HPV a little bit. And HPV stands for what's the name? What's the official name of this virus?
The human papillomavirus. There are probably hundreds of strains of human papillomavirus out there, but we have identified 14 strains that tend to be higher risk for causing cervical cancer. So when you are tested for HPV with your pap smear, you are only being tested for those 14 strains that could cause cervical cancer. The other strains can cause genital warts. They cause the warts that happen on other parts of your body, and some of them don't cause any issues. So we're not testing for every single one out there, just the ones that can cause cervical cancer. The tricky thing is men cannot be tested right now, and we don't find that testing men is helpful because they cannot get cervical cancer. They can, however, get penile and anal cancer, although those tend to be much more symptomatic, and so typically would notice an abnormality, whereas with cervical cancer, you may be completely asymptomatic until it's too late.
Right. And given just women's anatomy, it's all internal, so
Yes,
you're not going to see anything.
exactly.
Hey there, it's Felicia. Thanks for listening. I'd love to include your questions or comments in an upcoming episode. To leave me a message, please call 503-338-4654. If you've got a health question, I'll do my best to get you an expert answer. Again, that number is 503-338-4654. Now let's get back to our guest. Okay. So, is there any way that we can prevent cervical cancer? I mean, you said most people have HPV of some kind. What can we do to prevent this?
So there is an HPV vaccine out there that's being recommended for girls and boys ages 9 to 11. It's a 2-dose vaccine when you get it at that age group. If you get it a little bit older, then it's a 3-dose vaccine. This vaccine covers 9 of the highest risk types of HPV that will cause cervical cancer and genital warts. And we're finding that this vaccine is eliminating up to 70% of cervical cancers. That being said, it does not cover every single type of HPV. And so we're still recommending HPV and pap smear screening for people who have had the vaccine. They're just much, much less likely to develop an abnormality. The two types of HPV, type 16 and type 18, account for the vast majority of cervical cancers, and those are included in the vaccine. So we're really hopeful that with the rollout of this vaccine, cervical cancer rates are going to plummet in the next few decades. It's so important that boys get this vaccine as much as girls do, though, because they are the ones that can spread these types of HPV, although their risk of having any adverse effects from it is much less than women is.
Although from what you said about men getting, penile and anal cancer, and I've heard throat cancer as well, possibly.
Yeah.
And that's I mean, I don't know, I'm the mother of 3 boys. I'd sure like them not to have those problems.
Absolutely.
So, I mean, it seems like a good idea.
Hmm.
So, the vaccine or some version of it has been out for quite a while. I know when it first came out, I believe I was not the age group, I was out of my
Hmm.
teens when it first came out, but it's still been around for at least 10 or 15 years, hasn't it?
Yeah, it's been, I think, about 15 years or so. Yeah.
Well, I remember early on there were concerns with side effects.
They really haven't found much in the way of negative side effects, no more than any other vaccine that is out there. Everybody,
Okay.
there is always the chance of someone fainting when they get a shot or things like that. But the HPV vaccine has not really been shown to have any adverse outcomes.
Okay. Well, that's good news. Now,
Mhm.
of course, there are a whole bunch of us who were too old to get the vaccine. I think, there's an upper age limit for it, isn't there?
So when it first came out, it was approved for people ages 9 to 26. In the last year to 2 years, they've actually increased that to allow for people up to age 45.
Oh,
Insurance,
okay.
yeah, and insurance companies are slowly starting to approve that. So most insurance companies are now covering it up to age 45. You do have to get 3 doses. You get the first dose, and then 2 months later, the second, and then 4 months after that, the third. But I would highly encourage anyone who hasn't gotten it, call your insurance, make sure they're covering it for that up to age 45, which is the standard of care, and then go ahead and get the series.
Well, that's good news. And then you said that the likelihood of developing cervical cancer actually falls off the older you get. So, women in their 60s, is it basically not a concern at that point? What's the
It's always hard to say, but since HPV is sexually transmitted, the theory is that if you're not having new sexual partners, the chance of transmitting and acquiring HPV and thus getting cervical cancer decreases significantly. The other thing to realize is that cervical cancer is incredibly slow growing. It grows over a period of 10 to 15 years, which is why we often will see women in their 30s with cervical cancer from an HPV infection that they may have acquired in their late teens or early 20s. At this point, if women have had normal pap smear screening for 10 to 20 years before they hit age 65, the American Society for the Prevention of Cervical Cancer is recommending stopping cervical cancer screening at age 65 because the risk goes down significantly and cervical cancer is so slow growing that it's most likely not going to be the cause of death at that point.
Okay. Well, that's a relief at some point,
Right.
right?
But that being said, it's also really important if you haven't been screened regularly and you're 65, that doesn't mean you just get to stop screening. You have to have that 10 to 20 years of normal screening before you
Mhm.
can say I'm in the clear.
Okay. So, be good about getting your annual exams so that you can
Exactly.
retire from
Yes, exactly.
getting the pap smear and the HPV exam. Okay. If you were going to give our listeners some advice, what's that one piece of advice for cervical health that you would give them?
Do not assume that because you've had a pelvic exam, that you have gotten a pap smear. Pap smears are an actual collection of cells testing for the HPV virus. When a doctor looks in your vagina with a speculum, it does not mean they have done an actual pap smear. I can't tell you how many patients I have that say, well, I had a pap in the ED. The emergency department never does pap smears. That is a prevention tool that they do not do. Just because someone has looked does not mean they've done a pap. And that's especially important now that we're not doing it annually because people are not sure when did I actually have my pap smear.
Mhm.
And educate yourself. Get the records. Know what your pap result was and what your HPV result was. Because if you just had the pap without HPV testing, that changes the interval when you need to be screened. If you just have the pap, you need to be screened every 3 years. Whereas if you had the HPV test, it could be 5 years. With people moving around so much, I often don't know, well, which one did the patient have? And so I think
Right.
educating yourself on what you actually had done is the best thing that you can do to protect yourself.
Well, and just from personal experience, the HPV, exam, the collection is it's like feather touch. You may not even know they did it.
Mm-hmm.
So, Yeah, I think you're right on. Ask for the records, get your test results so you know for sure what was done, and so you can tell your next doctor when you move or if something happens. Yeah.
Exactly. Exactly.
Well, and I don't know about you, but especially with the crazy life of most women in those years of risk, I mean, you've got kids, you've got work, you just don't rely on your memory to keep it either.
Exactly. Exactly.
Well, thank you for joining me, and I know that you've got patients waiting for you and a busy day ahead, so I appreciate you taking the time.
Yeah, no problem. Thanks so much for having me.
Yes, glad to have you on. Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.